A cancer diagnosis is a significant emotional and psychological burden for both patients and their families. The disease often induces a state of crisis characterized by anxiety, fear, and uncertainty.
In some family, when we actually unfortunately diagnosed with cancer, is it actually create a very panic situation in the whole family, not only the patient. So it is a mental trauma for the patient. So first of all, we have to decide like through what is the qualified medical oncologist available in your city. So according to this, we will go for that consultation, and when the patients comes to us, we actually have a detailed discussions to have a history. We have a diagnostic procedures, because we a decade ago when, so basically first one was the diagnosis. So for the diagnostic part, we usually do the biopsy from the lesion that is most accessible, either interpreted by the radiologist, by intervention radiologist or pulmonologist. Now, after that biopsy, actually we confirm that what type of histopathological basis of the tumor it is. Like in lung cancer, we have the broad like non-small cell lung cancer and small cell lung cancer. In non-small cell also, we have different categories of histology, like adenocarcinoma, squamous cell carcinoma, adenosquamous, large cell carcinoma, that's all. So that's why diagnosis is very important, very crucial part of first step. Next step is the imaging. Imaging is important. Why? Because to know the status of the metastatic disease. Because in our Indian subcontinent, what in our for so long practice for many years, what I have found, that it is difficult to get stage 1, stage 2 lung cancer. It is we always get mostly stage 4, and some parts like 25% we get the stage 3. So this is actually the practical things that I am facing.
Cancer carries a stigma, creating a sense of isolation for patients. Fear and misconceptions often prevent people from seeking necessary care.
That 6 bad word cancer is very much, it basically horror to the patients. It is actually a sudden breaking bad news to the family. And not only that, we have a social stigma that this room has that cancer patients to avoid to go there. So there is a social avoidance is also there. And according to this, actually it creates a basically depression and isolation from the patient mind, and it happens in the family itself also. We have seen that. Okay, so when this cancer is diagnosed, it is a team effort. It is not like that we will give the medicine, it will go like this. So when I feel that psychologically patient is down, it is very important to give him a moral boost, not only the patient but also the family also, because for cancer treatment, that is a type of chronic disease, it is a long term treatment process, not is like ending in this one week or 10 days. So cost is very much involved in this. So that's why as a clinicians, we don't have to treat the patient, but side by side, I have to, number one, counsel the patient. What is the diagnosis? What is the treatment? How is the treatment available? What is the curability? And also the family, we have to counsel that it is not an infectious disease, right? In fact, patient can get infected because his immunity is poor. That's why he can get infection from the other person. But from patient to the other family member, infection, it is not possible. That is a basically misnomer, myth actually. So that's why we have to counseling about the cost also. We have to predict and detailed discussion with the family on the first, on the day one, what I am planning according to the stage of the disease, and what is the cost approximate, how is the survival of the patient, how this drug going to affect, and how is the response, how we can continue the treatment.
Immunotherapy is a groundbreaking approach in cancer treatment. By harnessing the body's immune system, we are unlocking new possibilities.
What are the different drugs? Because as you know, as a senior medical oncologist, I have been in experience in immunotherapy and targeted therapy. You have heard that, because these are actually new addition to the era of this cancer treatment. And it's a very marvelous response we are seeing even in stage 4 patients. So that's why it is very important to discuss about the patient assistance program, because that international companies actually help the patient to continue the treatment. They actually give 1 to 1+1 while free, like that. Different sets of free options are available, so that they can actually avail the treatment at the reasonable cost. The cancer patients, I used to tell, not only cancer patients but the in high risk population, because we have been seeing that young population actually indulge in cigarette smoking often. We can see in college, even school also. And now long term, this cigarette smoking or any form of the non-tobacco smoking, like in non-smoking devices like gutka, pan product, they are also addicted. So I strong advise them to keep avoid these things for taking in your daily life as a habit, because that will actually not only cause the cancer. You can see the smoking is also help for the young onset of acute bacterial infection, because we have seen recent rise of acute heart attack in young generation in early 40s. That was not found in a decade ago. So that is the very strong message, that don't indulge in any type of habit like any smoking or non-smoking device from any form of tobacco or like that. They should keep.
Contrary to popular belief, cancer doesn't discriminate. Even those who never smoked can be diagnosed with the disease. Protect your health by avoiding habits that can lead to cancer. You can make lifestyle choices that prioritize your well being.
And those who are actually having the occupational hazards, like in asbestos industry, wood industry, rubber industry, these industrial worker, I think they should get screening every year, so that they can detect if we detect a lung mass or anything at very early stage, we can detect it in a curative intent. That is the purpose. And those who have the very heavy history of smoking, like 15 packs years, then we can get a low dose CT scan for screening purpose every 3 years. So this should be a message to you. Giver who actually taking care of the patient, I would say be empathetic to them, because they are actually fighting. So we should all stand by the side of them. So give them moral support. Always give them positive feelings that it is, yes, it is actually going, it is treatable. You don't have to lose hope, because if the patient lost hope, then it is very hard for a physician or clinicians or oncologists to treat or continue the treatment. Even suppose patients have a good response to the suppose immunotherapy or targeted therapy or chemotherapy, but if the patient is morally down and he don't want to continue the treatment, or he don't want to go to the hospital for taking the treatment, then it is very possible to give him best care to the patient. So those who are giving caregiver, like a family or co-prayers, that always morally boost the patients, that yes, that is nothing, it is just like a chronic disease, like a diabetes or heart disease. If diabetes and heart disease is uncontrolled, that also can create a multi-organ failure. So it is nothing separate things. It is a single entity. So you don't have to bother about this. Just go ahead and get the treatment like that.
Beyond medical treatment, it's the care and love from family and friends that truly make a difference in the fight against lung cancer.